All right, so the next talk, we're going to have a man who's made a name for himself in the basic science of venous disease. Joe Raffetto comes to us from Boston, and he's going to tell us some new things from the bench. Joe?
That was for Dr. Almeida. Thank you, Dr. Almeida and Dr. Kadnick and Professor Veit for this kind invitation. So I'm going to talk about some basic science, and where I really wanted to focus the talk is on three areas. I'm a varicose vein researcher, but I do a lot of also clinical work. So I wanted to touch upon varicose vein pathophysiology as well as venous ulcer pathophysiology. We've heard a lot about it this morning, but also another area that's very important, venous thrombosis pathophysiology. So there's been a number of publications. I'm going to really focus in the last 5 years that have tried to understand what leads to these veins in the vein wall to dilate. And what I'm going to do is summarize some of the key findings that has been observed in the laboratory and published. And many of these are obviously in animal models and animal tissue. So one of the first things is how do MMPs and activation of venous dilation? What was found is that tissue hyperpolarization via activation of large conduction calcium-dependent potassium channels was found to be actually an interesting new finding that MMPs work through this mechanisms as opposed to just degrading the extracellular matrix. In addition, relation of venous tension and MMPs expression of venous contraction, what we found there was that if you increase the tension on vein walls, implying pressure, you actually increase the expression of two MMPs, the gelatinase MMP2 and MMP9, as well as decrease the contraction ability of the vein wall. And this is partially reversible by actually adding metalloprotease inhibitors, both specific and non-specific. Calcium is very important in smooth muscle contraction. This was also evaluated to see how metalloproteases affect calcium mobilization. And what we found was that MMP2 inhibits extracellular calcium influx through voltage-gated channels. However, it does not interfere with the intracellular calcium release through the cytoplasmic reticulum. Now, regulation of MMPs was actually studied by a colleague of mine who works in Dr. Davies' lab and now is finishing his clinical work. And he actually wanted to look at a upstream mechanism, the HIF regulation of MMPs. And what was found that was very interesting is that both HIF1 alpha and HIF1 beta are key regulators for both MMP expression, the protein, as well as the mRNA, and that if you inhibit hypoxia-inducible factor, is that you actually decrease these MMPs. Another important paper that was looked at and studied